Well, thanks everyone for tuning in. Before I get into the meat of the presentation tonight, I just wanted to thank Kelly for having me on, but also give her proper shout outs for her constant support and education for pregnancy. I've been working with pregnant women myself for about a decade. And it's way too common for the moms to experience regret because they just followed whatever the OB was telling them in terms of their recommendations. And they just feel like they're losing control over their own birth experience. So the more women who plug into someone like Kelly, the more women who are going to cherish the birth story because they felt, in control of it. So thank you, Kelly. Gosh, what's happening? There we go. Okay. So before I get into this is what we're going to cover tonight, but it's first off, congratulations on your pregnancy. I'm going to guess that if you're tuning in tonight and taking time out of your day to look at this, then something's going on. Maybe you're uncomfortable or exhausted, worried about baby positioning, or maybe just your previous birth didn't go the way you wanted it to, or maybe you just heard of chiropractic during pregnancy and wanted to see what all the fuss was about. But regardless of whatever your reason for joining us tonight, you're in the right place. This has been our focus at Hanson Family Chiropractic since we opened our doors. So feel free to ask as many questions as you like. So I don't know how many people watching this, know who we are, but we are a family practice in Batavia, and we specialize in prenatal and pediatric care. We take our work very seriously, but the vibe in our office is very laid back and upbeat and friendly. So it feels like a place that kids and families are welcome and not like a doctor's office. And this is us. I don't know if you can see the girls over there or if they're cut off by me there, but that's my award-winning team on the right. Obviously, that's me on the left. My wife is in the upper left-hand corner of that picture there. She actually left her teaching job 10 years ago where she taught elementary kids to help me start the practice. So in the beginning, it was just her and I, but we've grown since then, and we actually have a couple of newbies not pictured there. But if you call the office, these are who you'll talk to. And their importance in our office can't be overstated. In fact, if you read through some of our reviews on Google or Facebook or whatever, they get more shout outs than I do, which I try not to take personally. Just means I'm a good hirer is all. So here's some of the good stuff that we're going to go through tonight. Some of the things that our pregnant patients experience when they start getting adjusted. And the first and foremost is comfort. Because there are so many changes that your body goes through over the 9 months of a pregnancy, and most of them are uncomfortable. You have this bowling ball in your stomach that keeps getting bigger, and it impacts your sleep, it impacts your joints, your energy goes down, stress goes up, and sometimes there's nausea and other things that you experience along the way. And in the simplest terms of what we do, we just try to make you more comfortable. And I don't want to sound like I'm minimizing that. Because if you are uncomfortable, that means it's harder to do everything. If you don't feel good, your mom game's not on point. It's hard to prepare for your birth if you can't exercise or be active. It's hard to prepare for your birth with the birth plan if just mentally you're drained and exhausted, and if your body is all contorted from trying to deal with the new stress from the pregnancy, it's relentless. So again, just getting a release so you can physically move better and you can feel better provides so much to a person beyond just the feeling of less discomfort. But one of the most appreciated parts of chiropractic that most people don't know until they start under care is that the impact that getting adjusted has on the actual labor. Like labor time's cut in half. Pretty dang good, right? I don't know if it's your first baby or your 10th, but it wouldn't be nice if that took half as long, right? And it doesn't just stop there. The stats for women who are under regular care before labor have dramatically different birth experiences, meaning labor pain is reduced, better outcomes for mom and baby, fewer interventions from the OB, the list just goes on and on. But one aspect of chiropractic care is known for during a pregnancy is baby positioning. Now, chiropractors don't turn breech babies, of course, that would be pricing obstetrics. But by making sure that your pelvis and your hips are aligned properly is what gives baby a good home. And if you'll forgive the visual, your uterus kind of resembles like an eggplant that's suspended inside your pelvic bowl. And What keeps it in a nice neutral position are ligaments. You've got two in the front called your round ligaments that sometimes get uncomfortable. You might feel some discomfort or tension in the hips or the crease of your hips, but they can get stretched and can be uncomfortable. But you also have two in the back that attach to your sacrum, which is right at the base of your spine, and they act kind of like tethers. And if they're doing the job properly, they're all pulling equally to keep that eggplant right nice and balanced in your pelvic bowl, nice and neutrally. But what if your sacrum or your hips are rotated? Now that's unequal pulling on your uterus itself. And if it's torqued, it's hard for baby to get in the proper position. And if the uterus itself is torqued, it's hard to have a balanced and rhythmic contractions during labor. So by making sure that your spine and your pelvis are moving properly, there's a lot of really wonderful things that happen as a result. And the last one I want to point out is kind of the biggest one. It's really my favorite one to talk about, whether you're pregnant or not, because what chiropractors do first and foremost is work with your nervous system. Now, your nervous system, that's your brain, your spinal cord, and all the nerves. They're in charge of everything that your body does. Literally, there's a bunch of different systems of your body: your muscular system, your immune system, digestion, reproduction, hormones, all the different systems, but they all answer to the nervous system, which is what's telling them what to do. That's why they call it the master system. It's literally controlling every single cell of your body. But as big and as complex as your nervous system is, you only have two settings. You're either in fight or flight survival mode, or you're in rest, repair, growth mode, and that's it. That's all we got. And it's one or the other. It's kind of like an internal tug of war within your body, and on one side's trying to be the dominant one. But the survival response or stress response is not bad. It's just meant for the right situation. It's meant to deal with acute stressors like a bear attack or getting ramped up to deal with some sort of stressor and then be done with it. We should spend most of our time on the brakes. But if you think of just the stress load that your body is under, whether it's physical, chemical, or mental stress, that's just in your day-to-day life, and then you add the stressors of the pregnancy, it's no wonder that what we find with most of our patients is that they're stuck in survival mode. And if your body is prioritizing survival, that means it's deprioritizing all the healthy stuff. So one of the things that we do on your initial visit in our office is we literally test your stress levels. We have this really cool test called heart rate variability that tracks your heart rate and lets us know if that fight or flight system has become the dominant one. My favorite example of this is this lady named Kristen. She came in when she was maybe 6 months pregnant or so because her back hurt. That's why she wanted to get care. And I asked her about her stress load, and she said, it's good. She said, I had a lot, but we're past it now. And I said, great. And we did this test on her, and it looked terrible. I printed it out and showed it to her. And I was like, Kristen, are you okay? And she just started crying because it makes it real when you can see that sort of thing on paper. But what was interesting about Kristen was that she had gestational diabetes, and she was really frustrated by that because she was eating squeaky clean and she didn't want to do the medications. And what I explained to her is that if your body is in fight or flight, it's raising your blood sugar on purpose, not to hurt you, but to help you. It thinks you're in like an acute survival situation and you need the extra energy to deal with it. Problem was, she wasn't in an actual survival situation, but one of the neat things that we did was she had a little pinprick test to check her blood sugar, and I would have her check it before and after an adjustment, and immediately it would normalize. And in a couple of weeks, it stayed normalized. And she not only had a comfortable pregnancy, but she had the kind of labor she wanted because she never had to deal with the medications. But she also, just the global de-stressing effects of her care really just kind of brought everything, again, back into her control. So that was just cool to see kind of like the more global issues being addressed in addition to just her being, uncomfortable. So women who receive chiropractic adjustments in the third trimester were able to carry and deliver their child with much more comfort. So, obviously this quote references a third trimester, but I think you would agree the sooner the better. Getting more comfortable early has an impact throughout the whole pregnancy and delivery and even beyond, but it's obviously, never too late. We've seen women when they were just a couple weeks pregnant to a couple days past their due date. But I always think of it like you're training for a marathon or some sort of big race or event. It's better to start early, right? But it's better to start late than to not start at all, regardless of whatever stage you're in.
And sorry to cut you off there, Dr. Dave, yeah. But would you say even if you don't feel any discomforts, it's worth getting in and getting adjusted.
Yeah, and that's actually kind of my favorite kind of patient who comes in. We're seeing that more and more, pregnant or not, people that feel healthy and they just want to be proactive with just the general, health and where it's going. And just like, people are being more mindful of working out or what they put in their bodies nutritionally and other things. Chiropractic is like that. It's just a healthy thing to do, regardless of whether you're in pain or not. And especially with when you think about pregnancy, and not only all the rapid changes that you go through over that 9 months, but what comes after, right? The how well you recover from birth and pregnancy, it has everything to do with how healthy you went into it. And the whole postpartum process is quite a thing. I always tell moms, that the insane amount of changes you go through in 9 months during the pregnancy is nothing compared to what happens to the 9 days after the pregnancy, right? And when your body changes even more dramatically in a shorter time frame. And the general stress load that a mom's dealing with a baby on the outside is nothing compared to the inside. So the more prepared we can help a mom get with not only how she's feeling, but with how her physiology is functioning is huge. So that's a perfect segue there. So thank you. But to go through some of the specific things of what you're going through with a pregnancy, the kind of the first easiest to wrap your brain around thing in terms of the physicality and how chiropractic fits into it is just your center of gravity, which you may have noticed, with the bowling ball in your stomach. And what that does obviously is it draws your stomach forward, but it also makes your shoulders roll forward, and that causes your head to come forward. And when your whole center of gravity is shifted, your muscles have to compensate for that. And so a fun little test, if you're watching this at home and you have hopefully a little like space, is to get to like the edge of a room where maybe we're sitting against a wall or something. What I want you to do is close your eyes, put your arms out in front, and just march in place for 30 seconds. So we're not going to do it right now, but do it later, set a timer, and then just see what happens. What's supposed to happen is nothing. You just march in place and not move at all. But the reason why we have you do this test, we do it with all of our new patients in the office, is we want to see where your balance is. And the reason why we do it with your eyes closed is because your eyes don't help you balance, but they do help you cheat. So again, what's supposed to happen is you're not supposed to move at all. You're just supposed to stand there nice and still. But if your center of gravity is off and your eyes aren't there to subconsciously tell you to compensate, you'll go wherever you're leaning. So if you have a forward center of gravity, you'll march forward. If you shift to the left, you'll drift left. If you shift to the right, you'll drift right. And if your muscles are constantly compensating for that unconscious imbalance, not only is that uncomfortable, but that can cause dysfunction in your pelvis, which that can show up again in both the labor and delivery. And with hormones, there's obviously a lot of different hormonal changes that you're going through during these 9 months and beyond. But one that I wanted to highlight is relaxin, which you may have heard of, but what it does is it just what it sounds like. It relaxes your joints. The purpose of it is to relax the joints in your pelvis so baby has a smoother exit, so you have a smoother delivery, which is great. But it's being released throughout your whole body, which means that all of your joints are loose, which means unstable. So not only do you have unstable joints, if you've got an off center of gravity, you're going to feel that. And for this next point with the physiology, I want to bring up my spine guy here. Because one of the things that happens when you are pregnant is your front core gets shut off. You've got a baby growing out in front of your stomach there, and so your body intelligently shuts off your abs. You don't contract those on top of baby. So those are gone, and what you've got left are the core muscles in the back, and those just have to take over and do all the work. And so what that often means is that you start arching your low back, because that just it becomes like the dominant force there. But not only does that cause just the overall just contraction and compression of those joints, I don't know if you can see this, but all these little yellow bits that leave your spine here, that's the nerves that leave your spine and go to the various parts of your body. But they can get compressed too. And not only do these nerves control the muscles and the joints and the movement of your spine, but all your internal systems plug into your spine through the nerves as well. And it's really common for people to come in to see us that have back issues that maybe also affect digestion, because the nerves that supply to your digestion comes right through just this lower aspect of your spine here, and your uterus gets its nerve supply from right in through here. So if this part of your spine is all scrunched and those nerves get crunched, a lot of the time those rhythmic contractions aren't able to happen the way they need to, because their control mechanism, these nerves, are under stress and not able to do their job right. And then the sciatic nerve, which is a really common problem during the pregnancy, gets its nerve supply from way down here at the bottom, and that can cause a lot of discomfort, and that it happens way down there at the base. And the other thing I wanted to highlight is what this pressure can do specifically to your pelvis. So this is not flattering for Miss Skeleton here, but I want to show you what's happening with the opening, because obviously this is where baby comes out. But if you are torqued into your hip, I'm not sure if you can see this, but if your hips and low back are torqued in through here, that's going to affect baby's just ability to get to where they need to go, not only with having a smooth exit, but where they are positioned during the actual pregnancy. One of the things that most often brings moms into here is either the baby is not in a great position, or their previous pregnancy was in a bad position and they're worried about that now, because that torque and pressure can compromise baby's ability to get in the right spot. And that can obviously cause issues during the birth, which will throw off your birth plan. So something to remember is difficult labor for moms can be the result of pelvic contraction, inadequate uterine function, and baby malposition. So the correction of a sacral subluxation by a chiropractor may have a positive effect on all of these, which on all these causes of dystocia and lead to a better birth. So I use a lot of big words in there, apologize, but the one I wanted to highlight is dystocia, which probably you have not heard of, but it's the medical term for a difficult labor. So I don't know if your doctors are using it with you or not, but it's a really, really important word, because that's what takes you off course in regards to the kind of birth experience you want to have. Maybe you want a midwife and a doula and have a birth in a creek where you're watching the bunnies and the deer, as natural as you could possibly get. Or maybe you want to have a plain C-section, or maybe something in the middle. But regardless, that's your plan. And what takes you off your plan is when labor does not go the way it's supposed to, and that's dystocia. So the three causes to dystocia is a misaligned pelvis, a problem with the uterus is able to contract, and baby position. And getting adjusted addresses all three of these. So when people come in and they're pregnant, I'm always asking, what kind of birth experience are you looking for? And not because I'm wanting to push them in one direction or another. My opinion is irrelevant. What I want is for mom to have the kind of birth experience that they can look back at positively, because that's something that just drives me crazy. We see so many, kids and babies, and I always ask them what the birth process was like for their birth. And almost every time the mom's face just visibly falls, because they were, something happened during that labor delivery that didn't go the way they wanted it to. And, maybe they feel guilt or sadness or anger or just something negative. And it's so disheartening because it was such a big day. And, it's their first act as mom. And, wouldn't it be awesome if they could look back at that with joy and pride and just any sort of positive sense, which is how it's supposed to be. And so again, whatever birth that moms are looking for, that's when I want to help support by helping them avoid dystocia, avoiding that difficult labor. And that's why if we can see a mom during the pregnancy, especially early, there's so much we can do to not only deal with somebody's, pain or discomfort or whatever challenge it is, but also avoid who knows how many other problems that you didn't have or have to know because you didn't go down that road. So the Webster technique. I'm actually surprised by how many moms know what this is, and they come in their office specifically because they know I'm certified in the Webster technique. But there's a bunch of different chiropractic techniques, like hundreds of them. The Webster was created by Dr. Webster specifically to help pregnant moms and their babies. I touched on this a little bit earlier, so I'm not going to go crazy on it again, but what the Webster technique is, remember those ligaments that I mentioned earlier, your round ligaments in the front and the ones in the back that are supporting your uterus. The short version of what this is to make sure that those ligaments are balanced and that they have equal tension on all of them. So uterus itself is balanced and has equal tension on all of it. The adjustments are super gentle and very specific and very light. Nothing we do here in our office is like aggressive. Like I mentioned before, half of our patients are kids and babies. I adjusted I think 4 or 5 babies this afternoon that were under a month old. So we have a very light touch just in general. And it's true for our grownups as well, even if it's a, older dude with low back pain. But the effect of these gentle specific adjustments can be, profound. So you might be asking, how does a pregnant mom get adjusted if she can't lay, face down? We have these really awesome pillows. I should have brought one out, but they're just big foam pillows, and they have like a well cut out of the middle that baby goes in. So you're able to lay face down comfortably. I've never been pregnant myself, but I can only imagine what it feels like to, be able to lay down on your stomach for the first time in months, because it almost inevitably, by the time these moms get to like 8 or 9 months pregnant, we start getting like cash offers to take these pillows home because it feels so good to be able to lay face down again. And by the way, if you're watching this and you're nowhere near Batavia, please still reach out to us for a referral near you, because if you're searching for a chiropractor in your area and you're pregnant, please find one that's at least Webster certified. All chiropractors get like basic training during school on how to take care of pregnant moms, but you really want to see somebody who's specifically trained in this and has gone through that additional training and just has made this their thing. I think personally myself, I'm up to hundreds, if not thousands of hours of continuing ed specifically on pregnancy and babies. So, but you want at least somebody that's Webster certified. You can go through the website and see exactly who is in your area. Then they'll take better care of you than a regular chiropractor. So I know we're going to do some Q&A towards the end, but I want to at least cover some of our most commonly asked ones. So number one is, do chiropractors turn breech babies? No. That's the short version, because again, that would be practicing obstetrics. We have to be a little bit careful with our language here, because while chiropractors are very successful at resolving these breech positioning, we're not turning breech babies. But by working with your pelvis, your hips, and your low back, and making sure those are balanced and moving properly, babies go where they need to go. They don't need to be taught where to go. They don't need to be forcibly moved in position. They know where they need to go instinctively, and they'll get there. My job is to make sure that they are able to get there, and our breech patients almost always resolve. I haven't actually done the specific math on it, but I think 9 out of 10 women who come in here who are breeched, their baby turns. Of course, the sooner the better. But we had this one mom who came in because her baby was breech and she was looking for help with that. And she looked pretty pregnant. So I said, when's your due date? She was like, it was 2 days ago. I was like, okay, lay down. Let's do this. And I was only able to get 2 adjustments on her before she went into labor, but her baby actually did turn after that second adjustment. And I can't imagine what that felt like to have a baby that big turn so late, but she did. So question number 2, when is the best time to start care? Again, the sooner we can see, the better. Not only is to get you feeling better for the majority of your pregnancy, but I just like to think of it like you're planning for a race. The sooner you start doing that, the easier the training goes and the easier the race goes. And the recovery from the race is easier too. Because that's a whole nother thing with the postpartum recovery. How easy that goes really is dictated by how well the pregnancy goes. And lastly, is chiropractic care safe during pregnancy? Absolutely. I can fully appreciate if you've never seen a chiropractor before, or maybe you have and they were really heavy-handed, or maybe all you know about chiropractic is from the crazy videos on TikTok. But like I said before, our office in general we have a very light touch, and your comfort is paramount throughout the entire experience. And we've literally never had a single adverse reaction whatsoever. And if it makes you feel better, our malpractice insurance is literally the cheapest thing I pay for. We don't hurt people, so we don't get charged much. So if you were to come into our office, and probably most pregnancy focused chiropractors, the type of process is you basically come in for 2 visits initially. You'd be working with our front desk ladies to schedule that, but the first visit, you and I sit down, we connect and go over the health history as well as our exam process. On the second visit, we go over the results from the exam, and I'll make my recommendations, and we'll get you adjusted, and we present some sort of care plan. And everyone's care is different, and because everyone is unique, their pregnancy is unique, and there's not like a pregnancy care plan that we assign to everyone, because everyone who's going through it is an individual. If somebody comes in here and you feel great and you're super healthy and there's nothing going on, and you probably have a whole completely different care plan than somebody who's got, pain shooting down their legs on 3 different medications and who throws up every day and hasn't slept in 2 months. Different people need different things, and everything we do will be tailored towards you specifically. And this is based on, how you're feeling, what your goals are, and your exam findings. We also make sure we structure the care plans to take you through the entire pregnancy. And we do that because we don't just want to get you feeling better in the moment and then just cut you off, especially because towards the later stages of the pregnancy is when the most changes that happen within your body. And we want to make sure you're fully supported through the entirety of your pregnancy and even a little bit beyond. We always like to set it up so there's one more exam or scan after the pregnancy, because you're like a whole new human afterwards. Everything is different. So getting a new snapshot of who you are is huge. And we also see babies. So like anyone who's under care during their pregnancy, we offer their opportunity to get their baby checked at no cost after they're born. And sometimes we literally had one mom who came home or came to our office on her way home from the pregnancy. She came here before she even went home because she wanted to get her baby checked. And like when I have 2 boys myself, and we for them we chose to do we were in a birth center. We had a midwife and a doula. My wife's in a tub. You had the whole hippie vibe, right? And everything went great. No issues whatsoever. And but we brought them into the office right away because I wanted to do a scan on them. We one of the tests that we do in our office. And what we saw on both my sons was a big block of stress up here and a big block of stress down here on the other end of the spine. Basically, their whole spines were just torqued. And if you think about it, doesn't that make sense, right? They just corkscrewed through a birth canal. That's hard. If you've had a baby before, everything you feel, baby feels that too. Just they lack the ability to be like, Mom, it was crazy. Can you take me to see somebody? But all those compressive forces that mom feels, baby feels that as well. And the inverse is they're, corkscrewing through a birth canal. That's just hard. So it's just always a good idea to see these kiddos when they're born as soon as possible. And so we always like to extend that opportunity to our pregnant moms to get their babies checked on the house. And their first adjustment is on the house. And not only does that help them just physically recover from the birth process itself, like torticollis would be the most visual example of a kid with a kink in their neck. But it's usually more subtle than that. But a kid that can't latch properly, or who's colicky, or not sleeping well, or not pooping well. We had 2 new babies start with us this afternoon who both can't poop good. And if there was ever a Chiro home run, it was a kid that can't poop good. I should put that on my business card. It's funny because I imagine like grown-ups start pooping awesome as well after they're getting adjusted. They just don't tell me about it because they don't want to tell me about it. But I always think about this one baby that we saw. We saw since birth, like we do so many. But I was at like a health fair thing, and the mom happened to be there, and her baby was there, and apparently they were a little constipated. She's like, "Can you adjust him now?" I was like, "Sure." And I adjusted the kid, and they literally started filling his diaper like immediately. And I was like, and I handed him back to mom because once the diaper starts filling, it's your job. My job is done. But it's really pretty remarkable how quickly these babies respond to care. Because they're brand new, and whatever stressor is within their spine or their nervous system is quick. And far too often we see these kiddos when they're older, 9, 10, 11 years old, etc. And almost inevitably, if they've got a bigger thing going on, whether it's, autism or sensory processing or ADHD or just general anxiety, almost always when we see these bigger cases, it was what I would call an eventful birth. Maybe it was really fast or really slow, or the tools were used to get them out, or the mother of all birth, the C-section. Any and all those things, they're not necessarily bad. Thank God we live in a time and place where procedures like that are routine. But there's a consequence to that because they can increase the stress load on the baby during the birth process. And again, not saying they're the wrong thing to do. They're life-saving in certain cases. But they do increase the stress load on the spine, specifically this top part of the neck, which is not only the most vulnerable part of a baby during the birth process, it's the most important, neurologically speaking. This is no more important part of your entire body than right up in here. So this is why it's important for every baby to be checked post-birth. And that's not just me saying that through my own observations. decades ago, I think it was in the 60s, Dr. Gottfried Gutmann, a medical doctor, did a study where he looked at, I think it was over 1,000 babies post-birth, and it was evaluating their spine. And what he found was that 80% of them had a challenge within their spine that was significant enough to be compromising either their immune or nervous system. And that his conclusion was that, well, gosh, with results like this, all babies should be checked by a chiropractor. He was a medical doctor who was doing this research. And every decade or so, there's a new study that comes out that has like identical results. They're all large scale, 1,000+ babies. And they always find 80, 90, 95% of babies have this issue within their spine that, gosh, they really need to be checked by a chiropractor. And again, these aren't problematic babies. These are just a slice of all babies in general. And again, if you just think about how delicate their spines are, and if you start thinking about that as not just the structural thing that keeps you vertical, but the communication conduit between your brain and the rest of your body, well, gosh, of course that needs to be taken care of, not only post-birth, but throughout your life. It's just a general healthy thing to do. So yes, we see babies. Yes, we see teeny tiny babies. I adjusted my own sons when they were minutes old, and they're super healthy kiddos. I never had an ear infection, just super healthy kids. And that has everything to do with their bodies being in healthy control of themselves and maximizing potential. So, I don't want to go through like a ton of different case studies, on one at a time here, because we've seen so many pregnant moms. But if you're at all curious about chiropractic and pregnancy, I would encourage you to go through our Facebook page, our Google reviews, our websites. We have a website actually has pregnancy separated specifically where moms just tell their own stories. Because like I said, every pregnancy is unique and everyone's different and they experience it differently and they experience their care differently. But we've seen so many moms over the years that I would wager that you'll find something that resonates with you and sounds familiar to you and resembles what you're experiencing yourself. And it's just great to hear from other pregnant moms and not just myself. And also, I encourage you to just join us on social media. It's my wife who does all of this. I just do what she tells me to do when it's time to do a Facebook or an Instagram reel or something. And so, I apologize for any dancing or acting that you might see on there on my behalf. But they usually turn out pretty funny. So anyway, join us on there. If you want to, if you have any specific questions that you maybe want to talk about in private and not on here, or if you want to obviously set something up, reach out to us here. Like I said, if you're nowhere near Batavia, Illinois, please still reach out to us anyway. I've referred families out to as far away as Australia. There's a ton of chiropractors out there and I know all the good ones. And I think 3 or 4 times I've referred families to a specific chiropractor in Australia who probably wonders who the heck Dave Hanson is, who keeps sending him patients. But seriously, like not all chiropractors are the same. You can go to 10 different chiropractic offices and get 10 different experiences, none good or bad, just different. And if you're pregnant, you need a very specific kind of chiropractor, and I can help you find that person if you're not near us. So please reach out to us. If you wanted to come see us, that would be great. If you go to visit hfc.com and you can schedule it right online, they'll send you the paperwork right then and there. It's real easy. If you want to call us, and like I said, my staff will call you and answer any questions you have. But anyone who's watching this who took the time to hang out with Kelly and I and to go through this, we have a very nice discount for your new patient experience for taking the time out of your day to learn more about chiropractic and pregnancies. And anyway, I hope that was helpful. If we have anyone on the line who's live now with questions, Kelly, I don't know if I can see the chat box or not, but I'm sure you can. If anyone has any questions, you can throw them in there. Or if you have any questions, I can, of course, answer them now. But anyway, I just want to thank everyone for tuning in. And thank you, of course, for hosting and even beyond just tonight, just everything that you do just in general to help this population that really needs more TLC from people that are looking out for their individual experiences and stories and not just making them good patients like the medical world likes to do. So thank you.
Yeah, so there's nothing in the chat box. I did take a screenshot of one of your reels the other day, but it doesn't look like Oh, it was talking about sciatica.
Mm.
So is that one of the most common things that you see women for?
Yeah, it's one of the most common reasons we see just any adult for, because when people have stress in their spine, almost always is at the bottom. Everyone's problem is at the same sticking spot, right down here. Whether it turns into full blown sciatica or not, it's always at the bottom. The problem is almost never there, meaning the causal problem is almost never there. People have all this postural stress. It almost always inevitably starts in their head and their shoulders as they start to lose that war with gravity and drifting forward into this flexion dominant posture. And what that does is it forces your center of gravity forward. And that inevitably that stress just cascades down your spine until it hits the bottom floor where it's got nowhere else to go. And then that builds and becomes a squeaky wheel. And not only does that become uncomfortable within like your low back itself, but because your sciatic nerve is like, it's huge. I mean, it's like as thick as your thumb. It's this big fat guy that runs like down and through your glute. And with that buildup of pressure there, yeah, you're going to feel that. And whether it's shooting down one leg or both, I've never had it myself, but it sounds awful. And if you're pregnant and with all the things that come along with pregnancy, to deal with that on top of it just sounds terrible. So yes, that is a very common reason that we see our pregnant moms, but really most of our adults as well.
And then outside of your office, what are some things like we'll talk about yoga in just a minute, but
Yeah.
what are some other things that individuals can do between appointments?
Yeah, and most of it, I mean, it's perfect segue into the yoga thing because most of it is movement based. It's such like there's a lot of changes that happen during the pregnancy, but most of them are so physical, right? And with just not only what happens within the postural challenges, but most grownups have pretty cruddy posture in general. So like addressing that movement component is huge. And because relaxing is making all your joints just inherently lose stability, what's left over is muscular stability. And if you don't have that healthy core and healthy muscular balance to keep you stable and upright, then gosh, you're just at the whims of whatever gravity wants to take you. And so getting those posture muscles more active and engaged through general movement, but also specific stuff like what you're going to go through, that's the biggest thing that I could ask a mom to do. And again, even our regular grown-ups, but our pregnant moms in particular, because they've lost some of that instability due to their relaxing.
All right. Any other questions? Don't think so. So I have just a few moves that I was planning on going through for movement. Sorry. And so if you want to stop sharing, I think I'll take it back, or maybe I'll just claim the host.
I think you did it.
Okay. And then I'll share my screen. And of course, please feel free to share anything that you feel I haven't covered here. So I am sitting at my desk because I feel like that's what a lot of people do. And so I thought it'd be a really good time to talk about some of the key movements that we could do. I have a like birthing ball here too. I don't know if many people sit on one of these during their day at work, but this is also a great way to move your body, especially as a pregnant woman. And actually, I don't know this or if I've told you, but I'm actually 15 weeks pregnant myself with number 2.
Congratulations.
Yeah, thank you. So, so these are moves that, I try to incorporate when I have 5 minutes between meetings or, I just start to feel kind of crummy. So everything that I am going to show you really is meant to be a complement to the chiropractic care, not a replacement of at all. And a lot of times, and Dr. Dave, you could probably attest to this, you could tell us some moves that are good to do for specific issues, whether it's sciatic pain or something else. But for the most part, these are pretty safe to do. There's one that I'll call out with relation to any SI joint pain. And I'll call that out as we go through. So the first thing that I love to do are cat cows, and you could do these standing, seated, or on all fours, but just seated here, we'll do some movement in rocking our body forward. So bringing our chest forward, really starbursting our chest through our shoulders, and then pushing back, rounding our upper back, bringing our chin to our chest. So these are some moves that you can do and should do throughout the day when you get up, before you go to bed. If you're having that round ligament pain, this is a nice way to kind of stretch those ligaments before moving from a seated position to a standing position, which is sometimes when you get that sharp pain. And you don't have to do a lot of any of these movements, just incorporating, like I said, a few minutes of each during the day, you'll feel a lot better. Now, moving from this, we'll move to pelvic tilts. And so if you think about the pelvis, and I don't have my pelvis right here, but it's kind of like a bowl. And so a lot of times we're always tilting our bowl forward, arching our lower back. And a lot of times that's shortening those ligaments in the back that Dr. Dave was talking about, causing some low back pain, and just other pain can result from that constant arch of your lower back. So we're taking our pelvis from like a bowl tipping forward and imagining bringing that bowl tipping back. So we want the bottom of our pelvis to kind of come forward. So tilting back and forward, and we want more movement in the forward tilt than the back. Again, we're trying to protect our lower back. This is also great, in my opinion, to reset posture. Some days I'll be standing or I'll be sitting and I'll be thinking, wow, I have a really big arch in my lower back. And usually that comes with some discomfort. But one thing that I learned from a great pelvic physical therapist that I work with is imagine there's a string from your the top of your rib cage to your pelvic bone, and you want to keep that string really tight. So if you're always arched, that string's going to be really stretched out. So these pelvic tilts are working to bring that string back together. All right. And then the next move is a figure four, and you can do that seated just by bringing one foot over and just feeling that stretch in your glute area. This is great for piriformis issues. A lot of times I'll do a stretch like this, either seated like this, or in yoga we call it the pigeon pose, where I have this leg forward and my other leg back, and feel that stretch right before I go to bed. Now you can pair this with a twist. So just taking your opposite hand to your knee and twisting. This is where if you have SI joint pain, I would limit the twist that you do. We want to preserve our hip alignment. And you can do that on both sides. And then a really nice stretch, just because we are oftentimes just sitting with really bad posture, is to sit up nice and tall, reach one hand up, and then bring it over. Feeling a really nice stretch on one side body, and up and over with the other. And you can alternate, again, as time allows, really just stretching those side bodies. And then the last thing is a forward fold. So I like forward folds because it alleviates a lot of that low back pain and it stretches out your low back. It's taking a lot of weight off of your back as well. So forward fold, as we think about in yoga, doesn't always feel good, where we're coming like this. Some contraindications would be if you have high blood pressure. We don't want our head above our heart or our heart above our hips. And so the other thing to that is if we're at a desk, maybe we're at work, maybe we don't want to forward fold. Not to say that this alternative is much better, but rather than coming into a full forward fold, you can just step away from your desk, place your hands on your desk, and just stay here in like a 90-degree angle. And again, this is letting gravity bring the weight of your baby into position that's taking weight off of your low back. And that stretches your lat muscles quite nicely. Okay, so we went through those fairly quickly, but that really is just to say that you don't need a lot of time in your day to incorporate movement. I know a lot of times it's like, oh, I don't have 30 to 60 minutes to do like a full yoga class. You don't need it. You can incorporate yoga-like moves like those 5 that we just learned throughout your day, and you'll feel a lot better. Dr. Dave, I don't know if you have any that you would add to that.
No, actually, I was going to say the first 3 you went over are the 3 that I always send out to women. So we're like-minded there, and I'll probably include the other 2 as well, because that was perfect.
Great. Well, I want to thank you so much for coming and speaking. I know that part of my dream team in my first pregnancy and now here is a chiropractor. Unfortunately, I don't live close enough to you, but that is something where it's really something that we should be thinking about proactively, not reactively, because, you know, sometimes in a reactive situation, there is other pain that could potentially arise. And our body works as a whole unit. So it's not like just because we have sciatic pain that that the majority of our issue is right there at the sacrum. It can stem from many other places, as you pointed out. So yes, hopefully we reach a broad audience in the Batavia area. But if you don't mind sharing one more time your slide with how to contact you, I'm going to make you the host, and I'll just say that so everyone can copy it down if they haven't already, because I think it's important for them to get a hold of you, either to come to your office or to ask you who you would recommend.
There we are. Can you see me?
Yeah, that's perfect.
All right. So that's us. Yeah, please feel free to call or email. Like I said, we love finding people referrals. We've been doing that since we opened our doors. We've had people all over the planet who's reached out to us, and we always find somebody who's in your area. So whether you're in Illinois or in India, we know chiropractors near you. So please reach out to us, and we'll find somebody great.
All right. Well, thank you so much for being such an advocate for women's health in our area. I'm so glad we've had a chance to talk, and hopefully, we change some women's lives here tonight.
Thank you for having me.
You bet. I'll talk to you soon. Take care.
Bye-bye.